In this video, I'm going to talk about pernicious anemia. I'm going to cover the definition, the causes, the risk factors, the signs and symptoms, diagnostic investigation, and the management. Definition: pernicious anemia is an autoimmune disorder that causes a deficiency in vitamin B12, which leads to a decreased production of red blood cells. So before we move on, I would like to talk about vitamin B12. Vitamin B12 is a vitamin, also called cobalamin, that is found in animal products and also dairy products. So where we take food or we eat food, vitamin B12 unbinds itself from these foods by the action of hydrochloric acid. After it has been unbound, intrinsic factors found in the stomach binds with it to help its absorption in the ileum. So after it's been absorbed in the ileum, it enters the bloodstream. From there, it goes to the bone marrow where erythropoiesis takes place. Before we continue, we should understand what anemia is. Anemia is a condition where there is insufficient amount of red blood cell to carry hemoglobin. So I want to talk about the causes. The main cause is autoimmunity. Autoimmunity in the sense that the body's antibody, that's anti-intrinsic factor, damages the intrinsic factors found in the stomach. So if the intrinsic factor are damaged, then vitamin B12 will not be able to be absorbed into the ileum, and so it causes a deficiency of vitamin B12 in the bloodstream, thereby leading to decreased amount of red blood cell production. Let's move on to the risk factors. First, I'll start with inadequacy of stomach acid. Remember I said hydrochloric acid helps vitamin B12 to unbind itself from our food products. So inadequacy can lead to this deficiency. This inadequacy can be caused by medications, example proton pump inhibitors, hydrogen blockers, and other antacids. These medications are used for stomach disorders like peptic ulcer, gastroesophageal reflux disease. 2. Lack of intrinsic factor. Lack of intrinsic factor, this can be due to autoimmunity. 3. Avoiding animal products. Found mainly in vegetarians where they avoid animal products. Remember I said vitamin B12 is mostly found in animal products, or is found in animal products. So avoiding it will lead to a decrease or deficiency of it. As we have digestive disorders that can cause malabsorption, and also we have surgery. Surgery maybe due to one or two disease, your part of your stomach is being removed, especially the ileum where this absorption of vitamin B12 takes place is being removed. So there will be a deficiency, there will be a deficiency of vitamin B12. We also have excessive alcohol consumption as one of. So for the signs and symptoms, you find weakness, you find fatigue, you find abdominal discomfort. You also find some cardiovascular problems like palpitations, and you also find some cerebrovascular problems like numbness. Remember I said vitamin B12 is also important or plays a role in the function and development of nerve cells. There are also signs of confusion, lack of concentration, loss of memory. In severe cases, dementia will set in. So for the diagnosis, you do a blood test. Example, a complete blood count. You also check the level of vitamin B12 in the body. You also check for the level of methylmalonic acid. If there is high level of methylmalonic acid, there will be a low level of vitamin B12. You should also check for the level of homocysteine in the blood. If also there is a high level of homocysteine, there should also be a low level of vitamin B12. You should also do a reticulocyte count to check if the bone marrow is able to produce new red blood cell. Physical examination is also important in the diagnosis of vitamin B12. So for the treatment, medications are given which are injected through the muscle. Example of this medication is hydroxycobalamin. So other treatments or other managements can be this person improving the way he or she is taking dairy products and animal products.